Good afternoon. I'm Shelly Gill, Dean of Enrollment Management at LSUA, and today I have joining us our Department Chair of Nursing, Dr. Cathy Cormier.
Hi, everybody.
And we're here to talk all about nursing today. So, Dr. Cormier, if you could start off, LSUA is really known for our nursing program. What makes our program so special?
So, LSUA nursing program was started back in the mid-60s, and since that time we have had an excellent reputation of preparing entry-level nurses for delivery of quality patient care in the Cenla community. What makes us special in terms of a nursing department? We have qualified faculty to work with our students. We are also ACEN accredited, which means that we have met established standard by a nursing accreditation educational agency. We also have NCLEX pass rates. NCLEX is the RN licensure exam. Traditionally over 90%, which the national average for associate degree nurses is about 83%. And I'm happy to say in May, we actually had 100%.
Wow.
Our graduates get jobs oftentimes before they cross the stage, and we have 100% employment rate by our students.
Awesome. That's great.
Yeah.
So can you explain a little bit about the difference of educational programs in general if a student's interested in nursing?
So high school students, this is really important for you. When you're looking at different nursing programs, you need to know what type of degree you will be earning while in the curriculum. So basically there are two types of nursing programs. The generic nursing program, which offers a baccalaureate degree. Typically those programs are about 8 semesters in length, and that includes pre-nursing as well as clinical nursing courses. Usually the clinical nursing is about 5 semesters. And then an associate degree program, which is 4 semesters in length in terms of the nursing component. Both graduates, whether it be a generic 4-year program or an associate degree program, take the same licensure exam. Once that licensure exam they pass that, they are qualified to work as an entry-level nurse in any acute care or healthcare agency.
And I know when we talk to high school students, many of them think they have to be an LPN before they become an RN.
Yeah, so either the associate degree or generic BSN program, you are not required. We do have an LPN track for someone who has an LPN license and would like to return to school to become a registered nurse. We have an academic track for them, but you do not have to be an LPN to enter into a nursing program.
And LSUA's nursing program is for a registered nurse.
For a registered nurse. So we have 2 programs here at LSUA. We have the Associate of Science degree in nursing. Again, that would be 1 semester of prerequisite courses or non-nursing courses and 4 semesters of our clinical nursing courses. After that time, students can enter, once they pass the NCLEX, they usually begin work and they can come back to LSUA and enter our RN to BSN program. We start talking to our students about the baccalaureate degree when they enter LSUA nursing. So they're starting to pick up courses that don't necessarily count for the associate degree, but do count for the baccalaureate degree. So for example, I have students that graduated in December. They've already passed their licensure exam. They're starting their new jobs, and they're already enrolled back here at LSUA, and they will be finished their baccalaureate degree in December.
Oh, wow.
So the good thing about that is many of them have career goals of going to graduate school, either as a nurse practitioner. I like to talk them into being nurse educators because we have a shortage of nurse educators. Regardless, once they finish the associate degree, again, they can, once they finish or pass their NCLEX, they're ready to work. And then they come back to school in the RN to BSN program, which is 100% online. So they're able to work and go to school at the same time. So they're doing two things. They're getting their baccalaureate degree and they're getting a year's experience in a healthcare setting. And most graduate schools require at least a year clinical experience before they can go to graduate school. So many of them, after they finish the baccalaureate degree, we have several students now that are practicing what we call advanced practice nurses, working as nurse practitioners.
That's awesome. So what can a student who joins LSUA expect for pre-nursing students?
Students apply to the university, have to be accepted to the university first. We have a pre-nursing advisor who they can meet with one-on-one to help them with their curriculum plan. We have 5 prerequisite courses that the students must complete before they're ready to apply to the nursing program. And that is chemistry, the first anatomy and physiology, English 1001, and math 1021. We have a new course that will be coming up that will be now included as a prerequisite, and that is our pre-nursing course. It'll be nursing 1013. We're getting ready to embark on a new curriculum, and the pre-nursing course is going to be included in that. We feel that including a pre-nursing course in our curriculum is going to give students with a better idea of what the profession of nursing is really all about, and is it a good fit for them.
I agree with you. I think that's going to be a great class to add. If we're talking to high school students, what can high school students do now to prepare for a profession in nursing?
Anything you do now while you're in high school is going to better prepare you for college, and that goes for any high school student, whether you're going into nursing or biology or psych or whatever. For nursing, students that are strong in math, students that are strong in science, all of those courses build a strong foundation for you moving forward into college. Believe it or not, being able to read and write, good English, and strong reading skills, because once you get into nursing, there is a lot of required reading, and so actually strong academically all the way around is a plus if you're going into a nursing curriculum.
And for students who are looking at LSUA and thinking about transferring, or is there anything that transfer students need to understand about our nursing program?
We do have a guide that we use to help us determine whether or not transfer credit. What happens when a student applies to LSUA, they will have their transcript reviewed to determine what courses they can receive credit for. All of that information is available in the LSUA catalog, which is available 100% online through the website. Any student that's interested in attending LSUA nursing can also email our nursing advisor, Miss Liz Simons at esimons@lsua.edu. We'd be happy to meet with you one-on-one, or if you're at a distance and you can't make it to campus, you can shoot her an email, and we're happy to set up a phone conference where we can talk one-on-one with you to develop a curriculum plan.
What type of support services are available for our nursing students in particular?
So at LSUA, we do have a pre-nursing advisor, which again provides one-on-one counseling to students to ensure that you have a curriculum plan that facilitates your progression in the nursing curriculum. We have a wonderful library. In fact, the nursing department was just awarded funding to expand their online databases. This is particularly helpful to our online students in the RN-BSN program. So we have a more robust library resources available from your home. You don't have to come to campus to go to the library. Students that are enrolled in our pre-nursing classes have math tutoring available. We have tutoring in biology available. All of these courses or all of these resources will help you to be successful in the pre-nursing prerequisites for the nursing program. Our library also houses a writing center, which is very helpful for students enrolled in their English classes. And then once they get into the nursing program and they're required to do different papers and that type of thing, the writing center is available as well. We have this beautiful simulation lab for our students. These mannequins talk, they have heartbeats, they breathe, and so when we are preparing our students to enter the acute care setting, we oftentimes give them an opportunity to come in and work with our live mannequins, and this actually helps to hopefully decrease the stress and anxiety entering the clinical setting, because they have an opportunity to kind of practice things on the mannequins before they actually get to clinical.
So for our graduates, what are you hearing from our graduates? Do you hear from their employers? Do you get any feedback from them on the type of nurses that we produce?
Well, one of the best things about my job, I get to go to the hospitals and make rounds on our students that are currently in clinical, and while I'm there, I usually run into several of our graduates, because most of our graduates stay here in Central Louisiana. And I cannot tell you how rewarding it is to run into them in the hospitals and have them tell me how happy they are at their jobs. They also tell me that they feel like they were well prepared at LSUA for entry-level practice. As I mentioned, we have several graduates that now have completed graduate school and are working as advanced nurse practitioners in the local community. Our employers, we actually do an employer satisfaction survey, and we get very positive reports about our graduates, their ability to communicate effectively with their patients, their ability to work effectively as a team player, because that's very critical, being a member of the healthcare team, and being able to deliver safe, quality, patient-centered care.
Thank you.
You're welcome.
Okay, thank you so much, Dr. Cormier, for this great session talking all about nursing with LSUA.
Thank you, and again, if you're interested in LSUA and would like to meet one-on-one with a nursing advisor, please feel free to contact the main number at LSUA, and they'll forward you to the nursing department, or you can also email Miss Liz Simons, esimons@lsua.edu.